Alright, greetings to everyone and welcome to today's discussion in medicine. Yes, so in today's discussion we're going through anemia. Yes, so the stem of the question reads, Mr. Mwansa, male 52, was brought to the outpatient department with complaints of dizziness and breathing difficulties. Following investigations, a diagnosis of anemia was made. Yes, question A, it is saying define anemia, that is 5%. Define anemia. So in my definition of anemia, I'm saying anemia, basically this one is just a blood disorder in which there is a reduction in the amount of red blood cells or hemoglobin due to inadequate production of red blood cells, bleeding or hemolysis, and it is characterized by dyspnea, tachycardia, and also dizziness. Yes, that is the definition of anemia. So what important things we have to include in our definition? It is very important for us to mention, to say in anemia there is a reduction in the amount of red blood cells and also hemoglobin. It is very important for us to mention that. And it is also very important for us not to say anemia, basically it is mainly caused by three major factors, of which I mentioned to say there is hemolysis, which is the destruction of red blood cells. We have bleeding, which is hemorrhage. Yes, excessive bleeding could lead to could lead to anemia. Then the last factor that could bring about anemia is it is inadequate red blood cell production. All these factors brings about anemia. Yes. Then question B, it is saying describe 4 classifications of anemia. Describe 4 classifications of anemia. Yes, so on the classifications of anemia, we have the first classification, which is hemorrhagic anemia. We have the other one, which is hemolytic anemia. We have the third one, which is aplastic anemia. And we also have the last class of anemia, which we call nutritional deficiency anemia. Yes. So these are the 4 major classifications of anemia. So what does each classification involve? What does each classification involve? So when it comes to hemolytic anemia, hemolytic anemia, basically this one is just a form of anemia that comes in as a result of excessive destruction of red blood cells. Yes, so there are certain conditions that brings about massive or excessive destruction of red blood cells, of which one of them is malaria. Yes, so in malaria there is excessive destruction of of red blood cells. Yes, we know to say the malaria parasites, basically they usually target the red blood cells. Yes, so anemia, it is malaria rather, it is one of the causes of hemolytic anemia. Other than malaria, we could also talk about sickle cell anemia. Yes, in sickle cell anemia could also bring about hemolytic anemia, due to the fact that in sickle cell anemia there is the lifespan of the red blood cells that usually reduce from 120 days up to 30 days or so. So meaning that could bring about hemolytic anemia. Yes. Then the second type of anemia, it is the hemorrhagic anemia. So hemorrhagic anemia, this one, it is a form of anemia that comes in as a result of excessive blood loss. Yes, hemorrhagic anemia, it is a form of anemia that comes in as a result of excessive blood loss. What conditions or what instances could bring about excessive blood loss? We could talk about postpartum hemorrhage. Yes, postpartum hemorrhage, it is one of the causes of anemia. Yes, specifically hemorrhagic anemia. Then the other one that could also bring about this same condition, it is RTA, road traffic accidents. All those could bring about hemorrhagic anemia, because in both of those instances there is excessive bleeding. Yes. Then the third one, it is aplastic anemia. So aplastic anemia, this one, it is a form of anemia that comes in as a result of inadequate production of what? Of red blood cells in the bone marrow. Yes, so that inadequacy could come in as a result of a prolonged exposure to radiations, or could talk about some abnormalities in the bone marrow, and many other instances that could affect the structure of the bone marrow, leading to low production of all forms of blood cells, including white blood cells and also the thrombocytes. Yes. Then for the last one, which is nutritional deficiency anemia. Nutrition deficiency anemia. For this one is basically a type of anemia that comes in as a result of low intake of blood forming elements. Example, we have iron deficiency anemia, we have folic deficiency anemia, and also have pernicious anemia. All those forms of anemia, they fall under the category or under the classification known as nutritional deficiency anemia. Yes, so these are the classifications of anemia. Moving to question C. Question C, it was saying state 5 signs and symptoms that Mr. Mwansa will present with on admission. State 5 signs and symptoms that Mr. Mwansa will present with on admission. So one of the signs and symptoms of anemia, it is what? Pallor. Pallor, it comes in as a result of reduced oxygen perfusion to the body tissues, or rather due to reduced blood perfusion to the body tissues. Yes. Then the other one could also talk about cyanosis. Cyanosis, it also comes in as a result of tissue hypoxia. The third one that I could also mention, I could also talk about general body malaise. General body malaise, similar to cyanosis, due to tissue hypoxia. There might be headache. Headache will also come in as a result of reduced blood flow of reduced blood flow to the brain. Yes, reduced blood flow to the brain would also bring about headache. Yes. Final but not the least, I could also include difficulties in breathing. Yes, dyspnea. There might be difficulties in breathing in in anemia. Yes, so those are some of the signs and symptoms that a patient with anemia is likely to present with. Moving to the last question, which is describe the management that you are going to provide to Mr. Mwansa from admission until discharge. Describe the management that you are going to provide to Mr. Mwansa from admission until discharge. So for this one, remember whenever I asked about describing the management, basically here we need to write two things. There is the medical management and also the nursing management. So under medical management, this is about two components. We have investigations and also the treatment. So under investigations, we could carry out a physical examination. This one, it will show us the signs and symptoms of this condition, such as a pallor, a tachycardia be present. Yes. Then we could also do history taking. History taking, it will review the predisposing factors of this condition as to whether it is genetic, or maybe it has come in as a result of an illness such as malaria. Yes. Then we could also do RDT test. Yes. We could also do RD test, as this one, it will help us in ruling out malaria. Yes, it will help us in that. Then other than that, could also collect blood for full blood count. Full blood count, it will show us the number of the amount of hemoglobin. It will show us the amount of red blood cells. All components of blood will be shown. Yes. So once we do FBC, basically it will do it will confirm the diagnosis of anemia. Yes. Then final but not the least, could also collect stool for microscopic culture. Yes, as this one to review as to whether this patient has got what worm infestations. Not to say worm infestation could bring in what iron deficiency anemia. Yes. So those are some of the investigations that could be done in a patient with what with anemia. Then from there, under the treatment, we can give some iron supplements just to help in the production of red blood cells. We could also do a blood transfusion. Yes, blood transfusion, it will also help us in what in treatment of what anemia. Yes. Then under the nursing management, there's nothing to talk about here. We just need to talk about the general management that we've been talking about of late. Yes, we just need to follow that ibuprofen, but there are specific things that we need to include in ibuprofen. Yes, otherwise that's what I had for you this evening, and have a blessed evening.